my gosh, Mickey couldn't get this person better, she should have done this, right? So what my grand idea here is, instead of us fighting amongst ourselves in just, treatment to treatment, we also shouldn't be fighting clinic to clinic. We refer people not only to one another within the same company, we refer people out to our competitors. And we do it on purpose, because sometimes we just don't have the skill set. Like, we do phenomenally well with 98.99% of our patients. And the other 0.1%, it's not up to me, even as the owner, to keep that person in my clinic just so that I can charge that person. It's up to me to not let PT fail for yet another customer. It's also not up to me to refer that patient back to the doctor. I don't know, we tried our best. They're not doing their home program. Okay, maybe they're not, right? Maybe that is the problem. But don't send them back to the doctor yet. Who should you call? A specialist, or a competitor who's a friend of yours who works at a different company, right? That's who we should be calling, and not letting the doctor be in control of where that patient goes. You've got friends. You know who likes to treat hips. You know who's really good at it, or women's health, or necks, or whatever it is. Call up your friend. Hey, I'm in a pickle. Number one, what should I do? Try doing these techniques. Okay, if that doesn't work, what should I do next? Well, maybe we can meet over the weekend and just chat about the patient, and I can show you some things. That'd be great, right? We're trying to revitalize our profession and not drive it into the ground, right? So let's let Illinois be a place where we refer to our competitors. Because when you pat them on the back, it might be a while, but they'll turn around and pat you on the back too. And the biggest thing is, if that patient is sent back to the doctor, and then the doctor sends them to your competitor, who gets the kudos for sending them to the competitor? The doctor. So who has more affinity now for the doctor? The therapist and the patient. Why wouldn't you be the one that gets the love, right? Give them love. They will love you back, right? So the way to build our community is to respect the differences, and the way to build our community is to encourage the differences to be there. Total cheesy thing. Have you seen the Android commercial, Be Together Not the Same, the rock, paper, scissors one? I love that one. And I don't even own a television, okay, but I saw that. So the rock, paper, scissors Android commercial, at some point in Revitalize you need to see it, right? Because we will, there's lots of enemies at this conference, and we're all sitting at the same table, right? To the big national providers, to the teeny tiny little people, to the, well, I can't believe you work in a hospital, and the people who still work at Pops. Who cares, right? We're all physical therapists, and we need to get along and start referring people to one another. This is a great microcosm on how to do that and how to literally put that into practice. Because if we don't refer to one another, those people get sent out after they fail to, at the second PT place, where they're going to go? To a personal trainer down the street. PT couldn't help me. Thank God I got the internet for these exercises. Now show me how to do them. Right? That's exactly what happens. Or, after they fail PT a couple times and the cortisone shot didn't work and the patient still doesn't want to have surgery, I guess I have to go to massage every week for the rest of my life. And then we all say as PTs, nobody wants to pay for therapy. That's because you pushed them out the door and you put them in the hands of a massage therapist who's willing to ask for money from them. That's a whole other topic. So, back to this. Should we take a break?
We do. So the next thing, we want to advance the slide there. Before we take a break, any questions about the lecture material before we go on to the lab material?
I have just a question. If you have seen this type of case since you walked in Monroe and
Yes, every day.
yes, okay. So scoliosis in idiopathic cause in an adolescent. Have you treated that and have you gotten results from that?
Okay, so that's a whole loaded question. I would say with some scoliosis isn't necessarily just a mechanical issue, it's really the nervous system that's closing down on itself. And if you treat the coccyx and you treat the specific tube dysfunction as it goes up through the spinal canal, you can get immediate results. Do they always stay that way? That depends on if the patient then continues to use it. If there's actual wedging, of course not. That's different, right?
But with wedging, I mean, there's dysfunctions that go on around it. You can start treating ribs, soft tissue between the rib cage. You can try treating away from the area, and then you can just train the muscles to take stability or off of it. So yes, it's not something that I say, oh goodness, a scoliosis patient, I'm not going to treat you. I'm going to say, let's see what I can treat and what I can't. And generally, if you treat what you can treat, you're going to get a decent result. I mean, maybe even a phenomenal result. But this is where the marriage of both manual therapy and motor control is essential. If you do the manual therapy only, redo the exercise, no. So that's the, you need something to get length and then something to keep.
Because it's like if you have a car that's involved in an accident and it's got alignment issues, either in the actual driving mechanism or it got crinkled on the side, just driving it around is not going to fix it, right? So you'd actually have to take it to a mechanic to fix the alignment, which then changes it, right? Or you would just say, all right, it's terrible at turning left, I guess I'll just keep turning right. Hopefully it fixes it, right? Okay.
It's a manual therapy bias.
As in, I know. I have to leave them with that on the bridge. Okay, we're gonna take a 15-minute break. We're gonna go verify who our subject